Your family history. It's more than old photos, and the holidays are a perfect time to get the potentially life-saving information you need. It's a part of your own medical puzzle. We're talking personalized healthcare. Personalized healthcare, it sounds kind of fancy. What is it?
The short definition of personalized healthcare is that it's healthcare built around you. It is the right care at the right time for the right person by the right provider. And essentially what that means for individual people is that we want you to participate in this, we want you to engage with the healthcare system, we want you to give us that information that you don't think is valuable, but really may be impactful for your health. So one of those examples is family history, but other factors are important too, like what are your religious preferences, what is your environment like, what are your finances, because that impacts your care and it impacts whether or not you can afford your medications. And so all of these characteristics about you are important to share with your physician.
There's a family history toolkit available on the Cleveland Clinic's website. It was created to help people gather the most beneficial information.
When we talk about personalized information, family history is one of the key pieces of information we can use to predict risk for disease. So even though you hear about all kinds of fancy genetic and genomic tests out there that are blood tests or saliva tests, what we know is that when it comes to predicting risk for disease, that family history is still the most predictive information. And it's inexpensive and it's easy to obtain for the most part.
So past the stuffing, and by the way, who in our family had cancer?
Thanksgiving and the holiday time is the perfect time to be having this conversation because many families do get together. Most people will start out by just asking their parents or their loved ones about their childhood or about the circumstances around which they grew up, and then move into asking about health concerns, what did grandpa die of, what did grandma die of, or what did grandpa go to the doctor for, what kind of medicines did you find in the cabinet when you were scrounging around during family holidays. And that often stimulates some conversation and can make it kind of fun as well.
Diseases that tend to run in families include diabetes, cancer, aneurysms, osteoporosis, and even high blood pressure. If any of your relatives have had any of these issues, you should share that information with your doctor.
It's just going back to the basics of what medicine is all about. It's really focused on you, your individual characteristics, your preferences, your biology, and we just need to know, we need you to partner with us so that we can understand that information better and use it for better health.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.